If your hands and feet have started tingling for no reason, if your balance isn't quite what it used to be, if your memory feels foggy or your energy is gone by mid-afternoon, please don't just write it off as getting older, because there is one quiet vitamin deficiency that causes every single one of those symptoms. It affects up to 1 in 5 adults over 60, and most people who have it have no idea. Their doctor has never even checked. I'm Dr. Sarah Lane, and I've spent years helping adults over 60 find the simple, fixable things hiding behind symptoms they were told to just live with. So let me give you the 8 warning signs of low vitamin B12 in order, the most overlooked ones first, and exactly what to do about it. Now, before we get to the signs, you need to understand why B12 quietly runs low after 60, because once you get it, every one of these warning signs is going to make perfect sense. Here's the situation. Vitamin B12 does two enormous jobs in your body. It helps build healthy red blood cells that carry oxygen, and it protects the coating around your nerves, the insulation, if you will, that lets the signals travel cleanly from your brain all the way to your fingers and toes. When B12 runs low, both of those systems start to fail at the same time. That's why the symptoms are so strange and scattered, a little tingling here, some fatigue there, a foggy moment that comes and goes. It doesn't feel like one disease. It feels like a dozen small annoyances of aging. And here's what actually changes after 60. To absorb the B12 in your food, your stomach needs plenty of acid to release it from the protein it's bound to. But as we age, stomach acid production naturally falls. And less acid means less B12 gets pulled out of your food even when you're eating perfectly well. On top of that, two of the most common medications at our age, metformin for blood sugar and the acid-reducing pills people take for heartburn, both block B12 absorption even further. So you can be eating meat and eggs every day and still slowly drift into deficiency. And here's the part that worries me most. The reason I'm making this video. B12 deficiency is easy to fix when you catch it, but if it goes on too long, the nerve damage can become permanent. That's why knowing these signs matters so much. So let's start with number 1, the one almost everybody misses. Number 1 is tingling, numbness, or a pins and needles feeling in your hands and feet. And I'm putting this at the very top because it is the single most overlooked sign of low B12 and one of the most important. Remember that nerve insulation I mentioned? When B12 runs low, that protective coating on your nerves starts to break down, and the nerves farthest from your spine, the ones out in your fingers and your toes, are the first to misfire. That's what the tingling is. That's the numbness, the burning, the feeling that your foot has fallen asleep when it hasn't. Now here's what makes this so dangerous, and it's backed by real research. These nerve symptoms can show up months, sometimes years, before anything ever appears in a routine blood count. People assume nerve problems are just circulation or old age or a pinched something, and meanwhile, a simple, treatable vitamin deficiency is quietly damaging the nerves. The fix here isn't to panic, it's to get curious. If you've got persistent tingling or numbness in your hands or feet, that's a reason to ask your doctor for a B12 test, not to assume the worst, but to rule out the easiest cause first. That's warning sign number 1. Number 2 is unusual fatigue and weakness, the kind of tired that sleep doesn't fix. And I'll be honest with you, this is the one people dismiss the fastest because everyone feels tired sometimes and we all expect a little less pep at our age. But this is a specific kind of tired because B12 is essential for making red blood cells. When it runs low, your body can't carry oxygen as well, and that's a form of anemia. Less oxygen reaching your muscles and your brain leaves you feeling drained, heavy, and weak-winded, going up the stairs you used to take easily. So let me give fatigue a fair shake, because not every tired day is a vitamin problem. Sometimes you're just genuinely worn out, and that's normal. The pivot is about pattern. If you're sleeping fine but still exhausted day after day, week after week, with no good reason, that deep bone-tired fatigue that rest doesn't touch, that deserves a blood test rather than another cup of coffee. Persistent, unexplained exhaustion is one of the most common faces of low B12. That's warning sign number 2. Number 3 is memory trouble, brain fog, and confusion. Now stay with me here, because this is the one that frightens people the most, and for good reason, but I want you to hear the hopeful side of it too. B12 is critical for your brain and nervous system, and when it's low, people experience foggy thinking, trouble concentrating, forgetfulness, even mood changes and confusion. And here's the part that almost nobody knows. In older adults, severe B12 deficiency can mimic dementia so closely that it gets mistaken for it. Studies have found that among patients evaluated for memory problems, a meaningful share have low B12 dollars, and some of that cognitive decline improves once the B12 is corrected. So here's the credit then pivot, and please hear me carefully on this one. I am not telling you that every senior moment is a vitamin deficiency. Most forgetfulness is ordinary, and I don't want anyone diagnosing themselves with something serious. But I am telling you this. B12 is one of the very few causes of memory trouble that is cheap to test for and sometimes reversible. So before anyone accepts a frightening explanation for new fog or forgetfulness, this simple, fixable cause should be ruled out first. That's warning sign number 3. Number 4 is a sore, smooth, or beefy red tongue and mouth problems. And this one surprises people because they'd never connect their mouth to a vitamin in their blood. But here's the mechanism. B12 is needed to make the rapidly renewing cells that line your mouth and tongue. When it runs low, that tissue suffers first. The classic sign doctors are taught to look for is a tongue that becomes sore, swollen, oddly smooth, and a deep red color, along with mouth ulcers or a burning sensation. Now, here's the useful part. This is one of the few B12 signs you can actually see in the mirror. A genuinely sore, smooth, glossy red tongue that won't settle down is a real clue your doctor will take seriously. The pivot, of course, is that a sore mouth has plenty of other causes too. Dentures that don't fit, a little thrush, a vitamin deficiency of a different kind. So don't overread one bad day. But a persistent sore, smooth tongue alongside any of the other signs on this list is a pattern worth a B12 test. That's warning sign number 4. Number 5 is pale or slightly yellow skin. And this is a quiet one because it comes on so gradually that the people who see you every day don't notice it, and neither do you. Here's why it happens. When B12 is low and your red blood cells can't form properly, you become anemic, and anemia drains the healthy color from your skin. It goes pale. There's also a stranger twist. Those faulty red blood cells are fragile and break down too early, releasing a yellow pigment that can give the skin and the whites of the eyes a faint yellow tinge. Here's the honest pivot, because I never want to send anyone into a spiral over their reflection. Skin color changes come from many things, and a faint yellow tinge in particular can point to the liver, so it's never something to guess about at home. The point isn't to diagnose yourself in the mirror. It's that if people have been telling you that you look pale or washed out lately, and you're feeling some of these other signs, that's another reason to ask for the blood test. That's warning sign number 5. Number 6 is dizziness, poor balance, and unsteadiness on your feet. And this one matters enormously because at our age, balance isn't just comfort, it's safety. Here's how B12 ties in. 2 ways, actually. The anemia means less oxygen reaching your brain, which can leave you lightheaded, especially when you stand up. And the nerve damage we keep coming back to affects the nerves in your legs and feet that tell your brain where your body is in space. When those signals get fuzzy, your balance gets fuzzy, and you feel unsteady. So here's the credit then pivot. Some unsteadiness has other explanations: inner ear issues, blood pressure, certain medications, and those are worth sorting out too. But I want to be direct about why this sign is so important. Poor balance leads to falls, and a fall after 60 can change everything. So if your balance has slipped, that is not something to just adapt to quietly. It is exactly the kind of symptom where you want to find every fixable cause. And low B12 is one of the most fixable ones there is. That's warning sign number 6. Number 7 is shortness of breath and a racing or pounding heart with simple activity. Now, this is climbing toward the more serious end of the list, so pay attention. The mechanism follows directly from the anemia. When you don't have enough healthy red blood cells to carry oxygen, your heart and lungs try to make up for it. Your heart beats faster to push the thin blood around quicker, and you breathe harder to grab more oxygen. So you find yourself winded and your heart pounding from things that never used to wind you. A short walk, carrying the groceries, making the bed. Here's the credit then pivot, and it's an important one. Shortness of breath and a pounding heart are symptoms you should never simply file under vitamins because they can also signal heart and lung conditions that need real attention. So this is not a wait and see sign, it's the opposite. If you're newly short of breath or your heart races with little effort, see your doctor and make sure B12 and anemia are part of what they check, because it's a common and very treatable cause hiding among the others. That's warning sign number 7. Number 8 is depression, irritability, and a low, flat mood. And I saved this for last, not because it's least important, but because it's the one people are least likely to ever connect to a vitamin. And that's a shame, because it can be so treatable. Here's the link. B12 is involved in making the brain chemicals that regulate your mood. When it's low, that machinery runs poorly, and research has connected B12 deficiency to depression, low mood, and irritability, particularly in older adults where it too often gets brushed aside as just how it is now. But here's the credit then pivot, and I want to be gentle and clear at the same time. Depression in later life is real and it is common and it deserves proper care. I am absolutely not telling you to skip that or to treat a serious mood problem with a vitamin. What I am telling you is that a low B12 level is one of the simple, physical, fixable things that can quietly drag a mood down, and it should be checked as part of the picture, not overlooked. If your spirits have dropped and you can't quite say why, this belongs on the list of things to rule out. That's warning sign number 8. So those are the 8 signs, but I'd be doing you a disservice if I stopped there, because there's one more thing you need to know, the piece most videos leave out. It's not enough to know the signs. You need to know whether you're in the high-risk group, because some people are far more likely to be running low, and they're the ones who should pay the closest attention. So let me tell you exactly who that is. If you take metformin for blood sugar, you're at higher risk. Studies show close to a third of older adults on long-term metformin run low on B12 because the drug interferes with absorption. If you take an acid-reducing pill for heartburn or reflux, the kind people stay on for years, that lowers the stomach acid you need to pull B12 out of your food. If you eat little or no meat, eggs, or dairy, you may simply not be taking enough in because B12 comes almost entirely from animal foods. And if you've had stomach or weight loss surgery, or a condition called pernicious anemia, your absorption can be blocked entirely. Now here's the credit then pivot, and it's the most hopeful part of this whole video, so please don't tune out before you hear it. If any of that sounds like you, the answer is not to worry. It's that this is one of the easiest things in all of medicine to check and to fix. A simple blood test tells you your level, and if you are low, correcting it is usually straightforward. A change in diet for milder cases, an over-the-counter B12 supplement that many older adults benefit from, or, for those who truly can't absorb it through the gut, periodic B12 injections that work beautifully. The whole reason I made this video is that this is a fixable problem. The tragedy is only when it goes unrecognized for years and the nerve damage sets in. Catch it early, and the body often heals. So let's bring it all together quickly because I want this to actually stick. Sign 1, tingling and numbness in the hands and feet, the most overlooked sign and one of the most important. Sign 2, deep fatigue and weakness that sleep doesn't fix. Sign 3, brain fog, forgetfulness, and confusion, the cause that's worth ruling out first. Sign 4, a sore, smooth, beefy red tongue you can see in the mirror. Sign 5, pale or faintly yellow skin. Sign 6, dizziness and poor balance, which matters for falls. Sign 7, shortness of breath and a pounding heart with simple activity. And sign 8, low mood, depression, and irritability. None of these signs alone proves a deficiency, but if you recognize several of them, especially if you're in one of those high-risk groups, that is your cue to ask one simple question at your next visit. Could we check my B12? These are small things, but for a deficiency that quietly damages the nerves before it ever shows up in your blood work, catching it early makes all the difference. Now, I know that's a lot of signs and risk factors to remember, so I made it easy for you. I put all 8 warning signs, the high-risk groups, and the exact question to ask your doctor into a short free guide you can keep right on your fridge or take with you to your next appointment. The link is in the description and pinned comment. I go grab it. It's completely free, and I genuinely love to know which one of these 8 signs surprised you the most. Tell me in the comments, and if you've already found out you were low on B12 and felt better once you fixed it, please tell us, because someone reading this needs to hear that it gets better. Now, Now, a gentle but important reminder before you go. Everything I've shared today is for education, not personal medical advice. And B12 is something to confirm with a blood test, never to guess at. So before you start a supplement or change anything, especially if you take metformin, acid reducers, or any other medication, please talk to your own doctor first, because your situation may need a different approach. If this helped you understand your body a little better, do me a small favor and subscribe, so the next person who's been told to just live with their tingling and their fog finds their way here too. And go ahead and watch the video on your screen next. I think it's exactly where you should go from here. I'll see you in the next one. Take care of yourself.